Hey everybody, just Trevor here, here at Elevation Physiotherapy. I'm here with Albert Chan. Chan? Chan. And we're here to talk. What's that?
Let's do that again.
Oh, no, I can't.
Oh, it's
That's
a lot.
fine. Yeah, that's fine. We're here at Albert Chan here at Elevation Physiotherapy, and we're here to talk to you guys about IMS therapy. And I'm here to pick his brain, and we'll learn everything we can about IMS therapy, which is a treatment that Albert uses in his clinic to treat all sorts of disorders, right? So what is IMS there, Albert?
So IMS stands for Intramuscular Stimulation. It's
Okay.
it's a type of treatment that's considered what's called dry needling. And so dry needling essentially means that we're sticking a needle into somebody but not administering medication. So there's no administration of any drug like cortisone or lidocaine or anything like that. So dry needling is a large umbrella term. There's categories of that. Some of the different options of treatment underneath that term is, for example, traditional Chinese acupuncture is considered dry needling, and IMS is considered dry needling as well. And so IMS stands for Intramuscular Stimulation. It's the use of a sterile acupuncture needle, and we're inserting it into muscles that have become very, very tight.
Oh wow.
And some of the reasons why these muscles get tight could be from disuse atrophy. Someone's been in a cast, muscle shortening. But one of the more common reasons why muscles get tight is because they get weak.
Oh, okay.
And so these muscles are sometimes can be very deep, and we're inserting a needle into that muscle. And when that muscle senses the presence of the needle, so for example, this is a muscle, and it's not letting go. When I stick that needle into that muscle, the muscle senses the presence of the needle is going to contract, and that contraction sets off a reflex relaxation. And so it's called intramuscular stimulation because we're going into the muscle. Some people say, stimulation, so are you, hooking it up to electricity or anything like that? No, we're not. We're just stimulating that muscle to contract.
What are some common concerns with IMS? I know you have a lot of patients come in all the time. I know that I have some clients here, and they're just, the thought of having a needle come into their body, it's very uncomfortable. It's very nerve-wracking at first, especially if you don't know what it is. So a lot of people try to go with deep tissue massage and go, oh, well, I can go deep tissue massage. My therapist goes really, really deep. But what are some advantages and disadvantages against the two? I mean, obviously IMS goes a little bit deeper, but...
Yeah, so, massage does have its purpose. I guess the term deep tissue is, just a means of pushing harder as opposed to relaxation massage. Some of our muscles in our body are very deep, and so regardless of how hard you push on somebody, it's going to be it's virtually impossible to get down deep. You're just pushing harder and harder, as opposed to relaxation or soft massage. So the advantage of IMS or intramuscular stimulation is that is twofold. It is precision. We can get really precise as to which layer of muscle and which muscle I want to get to, and depth. So it's precision and depth. I can get down, for example, there are arguably about 4 or 5 layers of muscles in our back, and for some people it could be that thick. And deep tissue massage, although we're pushing harder, we can only virtually indent the skin, maybe the adipose tissue on top, and maybe the superficial muscles on the top. Whereas if I stuck a needle into a muscle, I can get all the way to the vertebrae, into the spine.
So a little bit more at the source of the pain.
That's right.
What kind of treatment? What kind of injuries, or I guess disorders, or injuries, or pain do you usually treat with IMS?
Any time a muscle is tight, and so we are using it specifically to treat a tight muscle. And so oftentimes we'll use IMS I'll use IMS for both diagnostic and therapeutic reasons. If I'm trying to establish a differential diagnosis, I'm wondering if that particular muscle is at fault, I'll stick a needle into that muscle, and then we'll reassess to see what the outcome of that intervention is. If the patient is considerably better, then I know that I was right. And so we're using it as a tool for both diagnosis as well as treatment. So if that muscle released and the patient felt considerably better, if the movement of that joint was better, if the patient's pain was a whole lot better, then we can proceed to say, okay, well, that muscle obviously was at fault, and then we have to go on to ask the question why. Okay. Why was that muscle tight to begin with? And there might be a whole host of reasons why.
And then that's where you come in. You can develop a specialized plan to hopefully get at the root cause of making that muscle tight in the first place.
That's right.
And then just treat it with, to sort of exacerbate a little bit of the pain and discomfort for a little while.
Yeah, our attempt always is to try and, as best as we can, to figure out the root reason for why that muscle was in dysfunction in the first place, why that person has pain in the first place. And so it's trying to get beyond just treating symptoms and understanding how that symptom developed and how that symptom is behaving, and ultimately trying to determine the cause, the true nature of the cause for why that problem began with. Sometimes we're successful, sometimes for us as human beings, we're able to determine that, or at least we're trying to get as close as possible to that cause. We may not always know for sure, with absolute certainty, but again, we're constantly trying to strive not just to treat symptoms.
That's right.
And trying to see whether or not so if a muscle was tight, one of the reasons why it might tight, I might go in and retest that muscle strength, and if I discovered that it's a bit of weakness, then oftentimes muscles will get weak because are tight because they get weak, in which case then I have to give that patient a strength exercise so that muscle does not get tight again.
Oh, okay. Now you have a bit of materials here. And would you mind just showing us kind of maybe on yourself?
Yeah, for sure.
Kind of what it's
like. Are you sure you don't want me to stick some needles in you, Trevor?
You can if you want. No, I don't mind.
I won't do that. One of the common questions that I get asked quite often is what is the difference between IMS and acupuncture? And so I say they're cousins. One's an Eastern cousin and one's a Western cousin. So traditional Chinese acupuncture is based on Eastern medicine. They are not necessarily treating tight muscles. They may stick a lot of needles in you. Their view of the body is such that there's the flow of energy called qi through you, and they're trying to balance that through various meridians or channels of energy in the body. And so there are all the meridians in your body correspond to certain names. So for example, there might be a liver meridian here or a kidney meridian here. For us as Westerners, we think that's a little bit different and odd. So I'm not trained in Asian or Chinese medicine. IMS is the Western cousin in the sense that we are treating muscles and bones. And so it's essentially the musculoskeletal system.
Okay.
So that would be the difference. Traditional Chinese acupuncture oftentimes sticks many needles into you, and then you're essentially left lying there for say about 20 minutes or so. IMS is very brief, very quick. The needles goes in and essentially comes out fairly quickly. Okay, so essentially it is a clean technique. Okay, we are using alcohol to clean our skin, the area that's being treated, the gloves as well. It's that way we reduce the risk of a bacterial infection.
Right.
Okay. And so the needles themselves are sterile and comes in blister packs. Okay. And once they're used on a person, they are discarded into a sharps container.
Perfect.
So there's no risk of cross infection.
That's always good to know.
Okay.
For sure.
So the needle itself has a handle. Okay. And then you can see the needle, the stainless steel needle there. And
Can you
this
see
is the
that there,
guide
guys?
tube.
Yeah, let's get us in here. Let's see us.
And that's the guide tube there. Okay, I have a guide tube in here. So I never touch the stainless steel portion of it. That stays clean. Okay. And here's my thumb, and I'll just demonstrate on me. The thumb and the hand has a lot of veins, so if I do get a little bit of a small bleed, don't be alarmed. But essentially what it is, it's the insertion of the needle, and if I relax my finger, you will see actually my finger twitch. Because that, as the muscle contracts, okay, that muscle is going to contract, there it goes. Did you see that? It moves my finger, okay? And then it's removed, and that's one spot. And oftentimes I'll palpate to see where under the next muscle band is tight, and then I'll do that again. Okay, and as you can see, the needles are so tiny and so small that if you can see where the vein is. If you avoid the vein, you can actually put a needle into the muscle, and you have no bleed.
Well, that's always really good. Is there any discomfort, any pain when it comes to doing this sort of thing, or is it?
For sure. So you asked me what a disadvantage of IMS is over deep tissue massage, and so it is not a comfortable treatment.
Okay.
And so here's a muscle. Now you have to understand that if a muscle was normal, you could actually insert a needle into the muscle, and you actually would feel nothing because that muscle was not tight. It's a normal muscle. You would actually feel nothing. I could stick a needle into a normal muscle, take it out, and say, "There you go, Trevor," and you'd say, "What do you mean? I didn't feel a thing." You didn't do the thing, did you? I said, "Yeah, I stuck a needle all the way into back and told it up. It was like, no, I didn't feel a single thing because that muscle was normal. However, if a muscle is in a state of tonic contraction and it has an increased amount of tone, then when I stick that needle into that muscle and that muscle contracts, it is uncomfortable. It's like a cramp. And then I usually tell my patients be prepared. Like right now, I've got a little bit of ache in that muscle, and be prepared for about a day, day and a half, sometimes 2 days of discomfort. Now that patient can continue to work and walk. I would just advise them not to exercise that muscle intentionally. So if I've done your quads, don't go down to your fit body boot camp and do squats.
And do leg day.
And do leg day. They can do arm day, just don't do leg day.
Just don't do leg day.
Because it's going to be sore.
Perfect. So that's really important, guys. If you're up here with Albert and you come down, you've had treatment of any kind, be sure to let your trainer know, myself included, of what they say. We always go based off what the health professionals say. Albert's really the boss, and we're just trying to help facilitate the best course of action to get you guys the best course of treatment and the fastest way to get you guys back to normal, back to healthy, and get you back in boot camp. So if Albert says, don't do leg day, let your trainers know so that we can modify things. We can create different workouts. Maybe we give you an upper body workout for that day, or simply avoid that muscle group entirely. Okay. So yeah, it was really good, Albert. Thank you very much.
You're welcome.
I hope you guys learned something, and thanks for joining me and doing an interview with me. I know it's different sometimes doing it live, and I really appreciate it. Guys, if there's any questions or concerns that you have for myself or Albert, be sure to comment just below here, and we'll follow up with you shortly after the video if we're not able to address it. Be sure to tune in a couple weeks for our next video. Might be on vertigo, so if you're interested in that, make sure to comment, let us know, maybe some things and some questions that we can have answered for you guys. But until next time, I'm Trevor Day and
Albert Chan.
And thanks for watching, guys.